feel really bad for the individual that had to call me, because I can't imagine what that felt like for him. I know how horrible it was to get that phone call myself.
It's 12:42. At 12:43, people who we take care of, their lives have been turned upside down.
The minute I heard where she was, my instinct just kicked in to get her to a better, safer place and eventually get her home where she needed to be.
We had finished up our clinic days and we were headed to a shaman ceremony. And during the ceremony there was like smoke and just different, various different things being burned in this kind of like a hut almost. It wasn't ventilated very much at all. It was like a branch, and he kind of like, not doused, but kind of did their little ceremony thing and kind of like spread it on your body. So then that was when I had started having the difficulty breathing and coughing and started having respiratory distress. They were giving me this breathing treatment and I started to feel better, and there was just, I could relax a little bit, I was breathing a little bit better, but then it was not even a couple minutes later and I had lost my airway. I wasn't breathing at all, and that was when one of the NPs that I was with, she had experience actually down in Haiti, and she started doing rescue breaths. It was, like an hour and a half to the nearest hospital, and they were, trying to gather all this equipment. They had empty oxygen tanks, an ambu bag, but no valve to connect it. They had all these supplies, and they had a pediatric ET tube, but they didn't have the blade that they used to insert, an endotracheal tube. So it was very scary, and I'm truly, kind of glad that I don't remember some of it, but the little bits that I do remember, it was pretty scary.
Hattie, she never even thought twice. She just was gonna get on a plane and go to Guatemala.
I just happened to be at the right place at the right time, I think. And thank God for that, because I know my country, and the limitations that we have for medical care are very extreme.
When they had gotten me to the hospital in Sololá, the NPs that I was with, the group that I was with, they're used to that emergency fast pace. Hey, somebody get the airway in, somebody get a line going, that collaborative approach. And in Guatemala, it wasn't like that. There was some hesitance in getting me intubated because they didn't have a surgeon. They had to call somebody to do it.
Getting her to the city was the goal, the emergency goal that we needed to do. Herrera Yerandi was amazing at getting all the information from me.
Dr. Newmeyer and Dr. Joseph they were on the phone with the doctors in Guatemala to make sure, that I was being cared for by intensivists that knew what was going on, because it was also kind of a special circumstance. I have a defibrillator, so I have an implanted cardiac defibrillator for congenital prolonged QT syndrome.
They waited a couple of days to see if they could stabilize her and get her off of the ventilator. But since that didn't happen, and then her heart rate started dropping a lot lower, she was dropping down into the 30s on her heart rate, and they didn't have the equipment to be able to check her defibrillator. It was too new of a device, and they just didn't have the technology to be able to do it. So we were able then to get approval through the insurance to be able to get her flown back to the United States.
I was there to receive her when she arrived in the ICU. After making sure she was stable hemodynamically was to take Charlotte away from the scene and to go with her to a quiet private conference room and just sort of do a data download.
For him to be able to sit and listen to the story as long as he did. I mean, he listened to every detail, and there's been times where we've told stories to doctors where you get the idea that they're not really listening to what you're saying, or trying to make you move on a little faster because what you're saying may not be important to them, but it's important to you.
So we oftentimes take care of their families just as much as we take care of them. We make sure that, because their families' lives have been turned upside down too.
We came back to the bedside, and we did our usual physical examination, and the first thing that jumped out to us was her heart rate.
In Guatemala, they don't have IV pumps, and that's a big patient safety concern. So they had nurses that were calculating these drips per minute. It seems like, when they really started pulling they pulled the pick and reducing the medications that I was on, that my heart rate gradually increased and was doing a little bit better. But it was a team approach. It wasn't, one nurse or one doctor that, had the dart on their back that they knew it all. It was everybody working together, the nurses working with the doctors, working with my mom and everyone. Just, it was amazing.
The academic environment of medicine here, we learn from the physicians learn from us, and there's no hierarchy. There's just that we're all equal members of the team, and that's a phenomenal way to take care of patients. It's not like at a private hospital where there is the physician, the nurse, everybody here is just part of the team. And so those multidisciplinary care rounds that we have, everybody contributes. Nutrition is just as important as the physician, as the pharmacist, as the nurse, and that's part of that. It is family-centered care, it's patient-centered care, and everybody's an equal member of the team.
You cannot ignore that expertise around you. And that's the one thing that I think we don't realize sometimes when we think, well, I know the answer. If we can utilize, every time I take a problem to my leadership team, I've already got an answer. The answer I come out with after that meeting and bringing it forward to them is way better than the answer that I had.
So the next day she was extubated, and we were on the road to recovery, and then getting out of the hospitals.
To this day, I still don't know some things, but the doctors, Dr. Joseph, Dr. Tang, Dr. Newmeyer, Dr. Singer, and even the nurses, the nurses also were great, because I was struggling with nursing school on where I wanted to go and what kind of nurse I wanted to be, and it was evident through the care that I got at Banner that I would love to do critical care nursing.
The staff on Diamond 2 West demonstrated better than any PowerPoint or any definition what compassion is, because we had a former patient who was so taken with her care that she wanted to be a part of that team.
At Banner University, I was somebody. The nurses in the ICU took the time to get to know me. They knew I was a student nurse. I wasn't a patient with just an ID band that needed medication. It doesn't matter who you are. They're going to treat you the same, and they're going to provide that outstanding and compassionate care.
This is one of those stories that should be told, because Banner takes care of the people. We could not have done everything that we did in Guatemala if it wasn't for the U.S. end of things. And we did, and it's a team effort, and that's what saved Amanda's life.
Had it not been for my mom and the people that she works with, the story wouldn't be the same. And I'm truly happy and blessed and just thankful.